Hi friends, I am Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about the baseline evaluation of a couple who is planning for pregnancy, because most of the individuals, they do come and ask like, we are planning for pregnancy right now, so do we have to do any basic investigations to rule out any underlying problems? So basically for a lady, baseline scan we advise transvaginal scan, because in that scan we'll see how about the uterus, how is your endometrium, and how are your ovaries, whether they are normal or do you have any cyst or is there any PCOD pattern. All these things we can make out with the help of a basic transvaginal scan. Second most important is like basic investigations like CBP, complete blood picture, to rule out anemia or any infection, and a simple RBS to rule out sugars, and then a simple viral screening, and obviously your thyroid hormones and prolactin hormones. Basically this thyroid and prolactin, if they are normal, well and fine. If they are abnormal, that needs to be correction before planning for pregnancy. And day 2 hormones like FSH, LH and E2 levels also we'll check it out, just to make sure whether all your hormones are under normal limits or not. And simple Rubella antibody test, because most of the individuals, they do conceive and they go for the miscarriages within first 3 months. So if you are immunized against rubella, like if rubella IgG it is positive, then definitely are having antibodies. If you are not immunized, then we usually advise for MMR vaccination as well. So these are all the tests, and baseline serum AMH levels. So with the help of AMH levels, we can know what is your egg development capacity, how about your ovarian reserve, so that we'll know whether you have ample of time or do you have to speed it up to become pregnant. So based on your AMH hormone also we can give you a better advice. So these are all the investigations carried out in a lady part, whereas even husbands is also 50% responsibility. So for him we usually ask habits about like smoking and alcohol. Smoking absolutely contraindicated, they need to stop smoking at any cost. Occasional alcohol is okay, that also too much of consumption, better to avoid those things. And if you are under a lot of stress or anxiety or irregular sleep patterns, all these things have to be corrected. At least minimum 6 to 8 hours of sleep is mandatory, and do regular workouts, yoga, breathing exercises to get relieved of your stress, whatever is there in your occupational part. And then coming to the investigations part, even for the husband, we want to rule out anemia. So baseline complete blood picture to rule out anemia, RBS to rule out any diabetes, viral screening of course, and then thyroid and prolactin hormones are also mandatory. And most important male hormone, serum testosterone, that's also more important. And apart from that, semen analysis. Basically in the sperm test, we need to have a gap of 3 to 5 days of abstinence is mandatory. And in a semen analysis, we rule out what is your sperm count, what is the morphology, what is the motility. Even in motility, progressive motility is more important. So all these things we come to know with the help of a simple semen analysis, which is it's an OPD just procedure. You need to collect your sample and give it to the andrologist. They'll give us the report, and then based on the report we can give you advice whether it's normal, it's fine. If it is abnormal, then we need to do some corrections. So friends, in this video we just discussed what are the baseline investigations which need to be ruled out prior to planning a pregnancy. And usually for the wife, we usually give folic acid and vitamin D supplement when you are planning for pregnancy. So friends, if you find this video is informative, please like my video and share with your friends and needy people. Thank you.